All right, let's go ahead and get started. I want to thank all of you for attending today. This is the sixth installment of a 10 webinar series that myself and Dr. Bill Vandergrift are doing. So if you missed any of the earlier webinars, you can get those replays still, don't worry. Just go to either bluebonnetfeeds.com or strideanimalhealth.com and then click on the webinars tab. And then if you scroll down to the bottom of that, you'll find where you can get access to all of our replays. And then before we get started, I do also want to point out that at the, I believe it's the right side of your screen, you should have a chat option. So please use that chat option as a way to submit questions that you might have. So you can choose whether those questions go to me directly, or you can submit them so that everyone in the audience can see them as well. So please use that function as we go along. If there's something that piques your interest and you want me to address that at the end of the session, I'm more than happy to do that. So my name is Dr. Jyme Nichols, and I am the nutritionist for Bluebonnet Feeds and Stride Animal Health. Today, I'm going to be discussing a unique nutritional technology. It is derived from the New Zealand Green Lipped Mussel, and the benefits that it can have for equine athletes and senior horses are pretty impressive. So I'm excited to share those with you today. Now, I'm sure that there are some of you that are sitting there thinking, the New Zealand what? Or maybe you're familiar with mussels and the thought of, you've got thoughts rolling through your head that are more along the lines of, you want me to feed ocean creatures to my horse? Don't worry, I get it. It sounds strange at first. So let's just start with the common name. Okay, so New Zealand, because that's the specific region that these mussels are from, okay? They are called green lipped because there's a vibrant green hue along the edge or the lip or tip of the mussel. And then when I say mussel, I'm talking about like M-U-S-S-E-L, okay? So the sea creature mussel, not the kind of mussel that you would be flexing your arms with, okay? So the scientific name for the New Zealand green lipped mussel is Perna canaliculus. And you may also hear to it being referred to as simply GLM, okay? So the abbreviation of green lipped mussel. So before I dig any deeper into what green lipped mussel is, I'm just first gonna hit the very high points of why someone would use it, okay? So first, it is very effective when dealing with arthritis. Secondly, it's very helpful when dealing with any kind of normal joint pain or stiffness that might be associated with daily training or normal exercise. Thirdly, it helps improve range of motion in joints. And lastly, it provides the body with just an excellent support mechanism for dealing with chronic low-grade inflammation. Okay, so I'm going to hit on the research and the details around all of this in just a little bit. But before I do, I'm going to just circle back to describing what the mussel is and how you can actually get it in a form that can be safely used for your horse. All right. So sourcing and handling of the green lipped mussel is very important. All right, not all green lipped mussel products available are created equal in terms of potency or effectiveness. Okay, so it's highly dependent on where the mussels were sourced and then how the extraction process was handled. Okay, so I think sometimes we get a little caught up in oversimplifying things if we don't have a full understanding of a particular topic. Okay, so here's an example of what I mean. Let's say, okay, so we're all horse owners here, right? So let's say that you're in the market to buy an own son of I'm a Dream Horse. Okay, I totally just made up that name in case you were wondering, but I'm a Dream Horse is the name of a really hot stallion right now, okay? So you have narrowed it down to two horses who on paper sound exactly the same. Okay, they're the same age, they're the same price, and both of them are own sons of I'm a Dream Horse, okay? So you decide to go see both of them in person. When you arrive at the first barn, you notice that the facility is extremely well kept. Okay, the stalls and the turnout areas are clean, they're well cared for. You walk by the feed shed and notice beautiful, high quality hay and an excellent quality feed stacked in the corner. And then when you go to actually look at the horse, you notice that he himself is in excellent body condition, his feet are in great shape, they're well kept. And then on top of all of that, the owner proceeds to tell you the exact dates of his dental exams, his last deworming, and everything that he's been vaccinated for, and the date that that was done. Okay, so clearly this horse has been handled and cared for in a way that just, I mean, absolutely exudes excellence in terms of, equine husbandry and care. Okay, so you know that you can't just buy a horse on the spot. You've got to go look at the second horse who's theoretically exactly the same, right? Well, when you arrive at the second place, you notice that the fences are broken. Okay, the pastures are full of weeds. The horses, all of the horses there look malnourished and they're standing in mud and manure. Okay, and then when the current owner leads your prospective horse out, you can tell that his feet have probably never even seen a hoof nipper. Okay, his hair coat is rough and it's dull. When you ask that owner about dental care and deworming and vaccination routines, the current owner just says they don't believe in doing any of that. Okay, so which horse do you buy? Are they really exactly the same? I mean, they're both own sons of I'm a Dream horse, right? I mean, if it's me, okay, I'm going to choose the first horse. And I'll bet most of you would choose that horse too, because you know that one of the best ways to invest in a horse's longevity is through proper and routine care of their health. Okay, so to tie this back to the presentation, and my whole point here, under the proper handling of green lipped mussel, I mean, this is very similar to that example. See, you can't just assume that all products that contain green lipped mussel are the same, just in the same way that those two sons of I'm a Dream horse were radically different when you actually went and got to see them in person. Okay, so as far as sourcing of the green lipped mussel, the mussels themselves are actually found on the shores of New Zealand. Okay, and the best ones come from very specific farmers. Now, I'll bet the thought of farming in the ocean hasn't ever crossed the mind of anyone listening. So these mussels are actually grown in the ocean by running ropes out on the water horizontally, okay? And then they tie pieces of rope every few feet and hang those pieces down vertically into the water, okay? So the mussels then grow on those hanging lines, and farmers can harvest those mussels at the appropriate time. Now, I say appropriate time because harvest time is critical for green lipped mussels. So the farmers that grow the best green lipped mussels actually harvest them at a very certain time of year when the omega-3 fatty acid contents are known to be the highest. Okay, and so for that reason, specifically, I mean, we essentially, when we are selecting our mussels for these supplements, we are choosing these specific farmers because they are selecting and harvesting these mussels at their prime. Okay. So then when it comes to handling, there are a couple different options. So the mussels have been harvested and now it's time for processing. The mussels can either be cooked and then freeze dried, or they can be cold pressed. So when you cook and freeze dry, you actually lose more of the beneficial fatty acids. So for example, one lab, so this particular example that I'm showing on the screen, found that cooking and freeze drying actually resulted in a loss of about 75% of the omega-3s that we really care about in comparison to the cold processing. Okay, so at Stride Animal Health, we are choosing to use a form of GLM or green lipped mussel that was processed using this cold processing technique, okay, because we want the most potent source of these specific fatty acids that we can possibly get. Okay, so now let's get into the benefits of the green lipped mussel. So GLM is one of the most potent sources of a very specific omega-3 fatty acid chain called icosapentaenoic acid, or ETA, okay? So ETA is an anti-inflammatory, and there are very subtle differences that make it that way, okay? So I've got two structures here. I've got icosahexaenoic acid on the left and then arachidonic acid on the right, which is a pro-inflammatory omega-6, okay? So the one on the left is an anti-inflammatory omega-3. The one on the right is a pro-inflammatory omega-6. So the only real difference here is that the ETA, the one on the left, has no double bonds at carbon 5 or carbon 8. Okay, so the lack of the carbon double bond at those two places actually prevents ETA from being converted into inflammatory prostaglandins and leukotrienes. Okay, so basically what that means is ETA is able to stop the formation of inflammation-causing chemicals within the body. All right, so let's talk about how it does that. So Greenlipped mussel is basically it's capable of inhibiting or blocking certain inflammatory pathways. Okay, so specifically, it downregulates the enzymes 5-lipoxygenase, 12-lipoxygenase, and cyclooxygenase 2, or COX-2 is the more common way that it's talked about. So to put this in perspective, NSAIDs, so non-steroidal anti-inflammatory drugs, so things like bute, okay, block the COX-1 and the COX-2 activity. Okay, that is anti-inflammatory, but by blocking that COX-1 pathway, you actually cause side effects such as reduced platelet clotting and gastrotoxicity. Okay, that's just a fancy way of saying that NSAIDs are known to cause gastric ulcers and gastric hemorrhage. Okay, so the take-home message here is that GLM, or Greenlipped mussel, is safe for long-term use in blocking inflammation because it does not cause those ulcers or that gastric hemorrhage. Let's take a look at how Greenlipped mussel is able to reduce that inflammation within the body. Okay, so keep in mind, the Greenlipped mussel contains that special omega-3 called ETA. Okay, now not to be confused with EPA or DHA, which are commonly talked about in fish oils. Okay, this is a different omega-3 called ETA. Okay, so ETA is a precursor for lipoxin production. Now, lipoxins are anti-inflammatory, pro-resolving molecules that are found within the body. So basically what they do is they help reduce tissue injury, they help reduce chronic inflammation, and they really just act as those kind of those braking signals which tell the body to switch off the inflammatory process. Okay, so the take-home message on this slide is that the unique omega-3 ETA that is only found in the Greenlipped mussel cues the body to clear inflammation quicker and helps lower the amount of that inflammation within the body altogether. All right, so let's take a look at some of the research behind the Greenlipped mussel. So a 2012 trial looked at horses with osteoarthritis in the fetlock. Okay, so this was an 8-week study, 56 days, where the horses received an oral supplementation of the Greenlipped mussel. The study was randomized, controlled, and double-blinded. Okay, and the results showed that horses on Greenlipped mussel had significantly lower lameness scores and better flexion tests after that 8 weeks. So let's take a look at some of the charts. When looking at the results of the lameness exams, so the left side of this, of the bold black bar, are the horses that were on the Greenlipped mussel, and the right side of the bar are the horses that were not on the Greenlipped mussel. Okay, so basically what they found was that 12 horses on the Greenlipped mussel showed improvement in lameness scores, and none of them got worse. Okay, there were some that stayed the same. 7 stayed the same. Now, in the group who received the placebo, only 3 horses improved, while 17 of those horses either worsened or stayed the same. Okay. Then when you look at the flexion tests, again, that chart is set up the same way, with the left side being the horses that received the Greenlipped mussel and the right side being those that didn't. In this particular section, 12 horses that were on the Greenlipped Mussel supplement improved in their flexion scores, and no horses got worse, compared to the control group where only 8 improved and 12 either worsened or had no change. Okay, so let's take a look at another study. This was an interesting study. It actually compared the use of the Greenlipped Mussel to using fish oil in 50 osteoarthritic patients. Okay, so basically what happened in this study, the patients who were taking a Greenlipped Mussel supplement showed significantly less pain after the first 4 weeks compared to the fish oil. Okay, so the interesting thing is that they then continued checking the pain scores at weeks 8 and at weeks 12, and they found that the patients who were on the fish or on the Greenlipped Mussel actually continued to see further and further improvement of their pain scores the longer that they were actually on the Greenlipped Mussel. Okay, so significant results within the first 4 weeks, and then continued improvement at weeks 8 and at weeks 12. Now, on the note of fish oil, it's well documented and it's well understood that fish oil has very beneficial anti-inflammatory effects. Okay, so it serves really as a very good baseline to measure against if we are trying to understand how much anti-inflammatory capacity the Greenlipped Mussel might have. So in this particular challenge, the researchers basically wanted to investigate the percent reduction in swelling by several common nutritional supplements. Okay, so in this particular model, they found that the Greenlipped Mussel reduced 98% of the swelling. Okay, and then comparing that, so they used olive oil essentially kind of as a control. I mean, we wouldn't really expect olive oil to do anything, but they did see a 12% reduction in olive oil. They looked at 2 different name brands of fish oil. Okay, so one was called Max EPA, which actually reduced the swelling by 17%. And then the second fish oil was actually a Norwegian salmon oil. And they actually found that one caused about 27% more swelling. So that one definitely went the wrong way. Flax oil. Flax oil actually reduced swelling by 31%. They looked at another supplement that on here is labeled as EPO. Basically, that's a brand name supplement that contained evening primrose, which resulted in a 37% reduction. And then lastly, ibuprofen was used basically as a positive standard. I mean, we expect to see that ibuprofen would have anti-inflammatory effects, and it did show that, but its reduction was only at 27%. So back to the beginning, I said that GLM, Greenlipped Mussel, reduced 98% of the swelling. Okay, so the take-home message here is that in this particular study model, the Greenlipped Mussel is much more potent than the fish oil, the flax oil, and even ibuprofen. So after noting the large difference between that reduction in swelling of the Greenlipped Mussel compared to the ibuprofen, I wanted to show the results of what those same researchers found when they compared the Greenlipped Mussel to other common NSAIDs or other common non-steroidal anti-inflammatory drugs. Okay, so the Greenlipped Mussel itself, so that's the first bar, along with the extracted lipids, that's the second bar. Okay, both of those showed essentially the same ability to reduce swelling in arthritic joints as naproxen. So a brand name that you might be more familiar with would be something like, I think Aleve is naproxen. Okay, so when you look at GLM then compared to both ibuprofen and aspirin, it was basically twice as effective at reducing the inflammation within those arthritic joints. Okay, so again, this is further confirmation that those unique fatty acids within the Greenlipped Mussel are highly capable of inhibiting those cyclooxygenase and lipoxygenase channels, which basically means it helps the body, it's basically helping the body clear that chronic low-grade inflammation very effectively, and it can do this without causing ulcers. All right, so let's talk practical applications. Okay, so the #1 place to apply Greenlipped Mussel in a horse's diet is if they're dealing with arthritis. Okay, so the particular studies that I highlighted today all looked at models where the horse or the patient was dealing with pain or inflammation that was specifically associated with arthritis. And those studies confirmed that the GLM is indeed a highly effective way of reducing that chronic low-grade inflammation. In fact, it even suggests that it could possibly even be an acceptable alternative to the long-term use of NSAIDs, especially since GLM is able to prevent that inflammatory cascade without causing the damage to the gastric mucosa, or in other words, it's not going to cause those gastric ulcers if you do use it long-term. Okay. Now, the second place that I recommend using the Greenlipped mussel is in a preventative maintenance program. Okay, so particularly for performance horses who are under daily training and daily show stress. Okay, so keep in mind that low-grade inflammation is going to occur basically anytime your horse has a hard workout, anytime that horse is going to perform at a show and exert itself, or even if it's going to be hauled or trailered for extended amounts of time. Okay, so I mean, inflammation is basically the body's normal response to exercise stress. Okay, so I am a personal walking example of this. Okay, I've had 3 reconstructive knee surgeries, which has basically provided me the unique opportunity to become very in tune with knowing exactly when my knee has been overcome with unusual amounts of inflammation. Okay, so I can tell that there is low-grade inflammation in my knee, not by looking at it, but by the feeling that I have on the inside of it. Okay, so if someone were to look at the outside of my knee, it looks completely normal. I mean, aside obviously from some pretty serious surgery scars, but on the inside, I can feel a persistent dull ache and tightness. Okay, so that's the same thing that's going to happen for horses. Even though their legs and their joints look nice and tight on the outside, doesn't mean that everything is actually perfect on the inside. Okay, so there can still be chronic low-grade inflammation in there, but by keeping those horses on a Greenlipped mussel supplement, you can actually significantly help those horses clear that inflammation and reduce that pain and that tightness that's associated with just normal daily exercise and traveling and hauling stress. Okay. So now, the moment you have all been waiting for, where do you get the stuff, right? What do I feed in order to provide Greenlipped mussel to my horse? Okay, so you can get Greenlipped mussel for your horse from Stride Animal Health. As I mentioned in the beginning of the presentation, we do use a very specific source of GLM that has been harvested and handled in a manner that makes this product as effective as possible. Okay, so when we're making products or developing products and sourcing ingredients for Stride, we want to make sure that what we're putting out to you guys is efficacious and is actually going to work when it gets in your hands. Okay, so the Greenlipped mussel is available in it's available under the brand name Rewind. Okay, so we've got a pelleted supplement that horses absolutely love the taste of, that you can top dress on top of just your horse's normal daily feed ration. Okay. We also have it as a liniment form that you can rub into your horse's legs. So post-exercise or post-hauling, you can rub that liniment in and just kind of get that extra bonus. And then as an added benefit, we love this technology so much that we've actually made it available in a human capsule that you yourself can take, and you can also use it for your dogs. So I personally use Rewind every day. I actually take 3 capsules a day for my knee, and also just for overall anti-inflammatory support. So, I mean, I try to work out every morning, and I'm actually able to do some pretty high impact stuff without any pain or any discomfort in my knee, as long as I stay on Rewind. Now, if I run out and forget to reorder, or if I just simply forget to take them for several days in a row, I can definitely tell the difference. So after those high impact workouts, the rest of the day, I'm feeling it. That chronic low grade inflammation is there and my body's having a hard time clearing it. Okay. I can definitely tell that I had not been taking my Rewind. Okay. Now, the last thing that I do want to point out for the horses is that Greenlipped Mussel and the Rewind products are completely show safe. There's nothing in them that will test positive. Okay. So with that, I really wanted to try to keep this particular presentation under 30 minutes. I think I was successful at that. I'm hoping that we can kind of get in and get out with these and just really hit you with some information on some products that maybe you didn't know were available. So with that, I'm going to check out the chat box and start answering some questions. It looks like I actually had quite a few that came in. So let's see, the first one, what was the model used in the study that compared the reduction in swelling of GLM to fish oil and ibuprofen? Okay, yep, so that was actually the Whitehouse study. So basically what they did is they used a rat model where they actually created arthritis in the paw of female rats, and then they just looked at how much swelling was reduced by administering each of those treatments. Okay, so that was the one where they gave them the Greenlipped Mussel, they gave them those two different forms of fish oil, the primrose, the ibuprofen. And I mean, it really was quite impressive at how much more effective that GLM was at targeting and preventing the inflammatory cascade that was specifically associated with that arthritis. Okay. Let's see. The next question was, how long should I have my horse on Rewind before I expect to see any improvements in their comfort level? Okay, that's a good question. So, you know, it depends. All right, that's like the best question. That's the best answer for everything, right? It depends. So if we look simply back at studies, okay, we know that in the one study with the osteoarthritic patients, there were significant improvements in pain levels at 4 weeks. Okay, so I always tell people, make sure that you have your horse on Rewind daily, every single day for at least 4 weeks before you're going to try to, you know, make any assessment of whether it is or is not helping your horse. Okay. Now, the side note to that is we saw in that same study that yes, there were significant improvements at 4 weeks, but then there were additional, even further improvements at 8 weeks and even further improvements from that at 12 weeks. So we know that there's kind of a compounding effect. So the longer that Rewind is in your body, the longer it's having that opportunity to prevent that inflammatory cascade, the more effective it is. So certainly you should see some improvements for your horse within 4 weeks. And by 12 weeks, that's kind of where I say you're probably going to get your maximum effectiveness. Let's see. Okay, can I use Rewind as a replacement for Bequia Ox? So that's trying to answer this politically correct. Okay, so I would never in a situation recommend that you try to use something like this as a complete alternative for a drug. Now, what we have seen there have been a lot of situations where once horses have been on Rewind for a while, the owners were able to start backing down the amount or the frequency of Bequia Ox. Okay, so now I'm not saying that all horses can do that. I'm just saying that has occurred. I have also had cases where they were able to come completely off of Bequia Ox. Again, it is going to be very dependent on what that horse is dealing with, why that horse is on Bequia Ox or Bute to begin with, and then just also the consistency that you have as an owner as far as feeding the product. Okay, so that really is a case-by-case basis. Yeah, I just want to be clear. I'm not recommending this as a replacement for Bute, and I'm not recommending it as a replacement for Bequia Ox. But it's possible that you could reduce some of the levels of those use for those. All right. Um, which is more potent, the topical or the oral version? And can I use the topical under standing wraps or things like back on track? Okay, so I didn't show, there's actually a lot of research behind this product, or behind GLN just in general. And I tried to just kind of pick some of the equine studies and the things that I thought would be most relevant to share with you today. But there is a trial that compared using the actual, like the oral muscle version versus the topical. So like, do you get the same benefits by using a topical that you do an oral? And they found that you indeed do. So I think there was maybe only a 3% difference in the reduction of swelling between the two, but statistically speaking, they were the same. So personally, I like to use the pellet because I know that they're getting it every day no matter what, because I'm going to feed every day no matter what. I may not ride every day, or the weather may be cold, and so putting a topical on a horse, on a daily basis can be a little bit of a challenge unless you really are riding them every single day and working them. So generally, I steer people towards doing the pellet on a daily basis and then using the topical kind of more as that bonus. So take that with you when you travel. If you're going to have a really hard workout, rub the legs down with that after your hard workouts. It is safe to put under standing wraps. So you can rub it down, you can put your standing wraps on. If you wrap legs when you travel, you can put it under those wraps. And yes, it is safe to use under things like back on track or ceramic therapies, magnetic therapies, things like that. So yep, that's absolutely safe. Let's see, is there any benefit to feeding half dose for maintenance, for preventative maintenance on an aging horse that's not in any work? Okay, so this is one product where I recommend not trying to alter the dose, okay? So the dose that is in there for a reason. We have based that dose essentially on, what we've seen from the research. So this is a situation where I would not recommend doing a half dose for maintenance. I would do the full dose, which is 180 grams per day, okay? It's a 148 cc scoop, and you just do 2 of those a day. So 1 in the morning, 1 at night. This is a product too that you actually don't have to split that. So if you only feed once a day, or if you only want to do your supplements once a day, it's completely fine to put that full 180 gram dose and give that to that horse just in one feeding. That's perfectly safe. So I'm going to answer just a couple more questions here. When would you feed Rewind over fish oil, or could you feed them together? Oh, very good question. I'm glad somebody asked that. So the places that the way I make this differentiation, if I am dealing with a horse that truly is arthritic or having some, stiffness, senior horses that have a hard time maybe holding their foot up for the farrier, or, have arthritis, have just had a long career and they're seeing the pain. All right, they're feeling the pain. That is where I definitely rely on Rewind, because those research trials, when you are looking at that particular situation, the Rewind is much more effective at clearing that inflammation than the fish oil. Now, the fish oil is going to contain, so with Rewind, remember, we are targeting the specific omega-3 called eicosapentaenoic tetraenoic acid, okay, so the ETA. Now in fish oil, okay, what we really like so the product that's called fish oil factor, okay, that is going to have actual fish oil, which is going to have very high levels of EPA and DHA, okay. It also has ALA from flaxseed, okay. So that product I'm going to use so it's actually very helpful for reducing inflammation within the intestine. Okay, so that's why fish oil factor is one of the main components in our immune health program and in our hind gut program. Okay, so it's going to have good anti-inflammatory effects throughout the body. That product is also very high in fat. Okay, so it's a 30% fat product. It's a flaxseed and rice bran base. So if you need calories in a horse's diet, if you need shine and bloom and that glossy hair coat on a horse, fish oil factor is the go-to for that product or for that effect. Okay, so the two can absolutely be used together. It just kind of depends on which the higher. If you can only choose one, it depends on where your priorities are. You know, do you want that outward visual appearance? Are you dealing with, you know, a horse that maybe has the gets a little sensitive along their digestive tract, things like that? Then I would go with fish oil factor. If you're dealing with an arthritic horse or a very high level performance horse and you want to help clear that inflammation on a daily basis and keep those joints clean and help prevent some of the breakdown that can occur in the joints due to inflammation, then I would choose Rewind. And if all of it's important, feed them both. Okay. Let's see here. Oh, another question was around allergies. Is Rewind effective with allergies? Okay, so here's another situation. We've actually got 3 products in our line that all have really major benefits with allergies. Okay, so Rewind and fish oil, both because of their anti-inflammatory and omega-3 properties, and then also the plasma, which we covered in depth last week. Okay, so if you have a really, actually a 4th product as well, the vitamin EC. Okay, so the antioxidants in vitamin E and then vitamin C. So, and I guess theoretically I should add ADR. I mean, man, there are just so many different things that affect allergies within a horse. So let me back it back up. This is the webinar on Rewind, so let me focus on that. Yes, we've actually shown that there are very good benefits for Rewind in allergies. Particularly, some of the research has looked at dermatitis issues, like in dogs, and then they've also looked at like respiratory and airway conditions in cats. And those both of those species, the research was actually quite impressive when they added the green lipped mussel into the diet. So we have actually seen a lot of success from our group among horses that are dealing with allergies, dealing with seasonal allergies. When they go on Rewind, are seeing some definite relief from that. Let's see. Yeah, we have a lot of questions on this topic. What is the dosage for dogs for the capsules, and what is the pellet dosage for the pony? Okay, so I guess the one thing I do want to point out on the dosage is it's really tough to overdo it. Okay, so I am much more worried about underdosing than I am overdosing. So typically on the capsules for the dogs, as a general rule of thumb, 1 capsule for every 50 pounds. Okay, so if you've got a little tiny dog that weighs, 10 pounds, still give them that full capsule. Okay, if you've got, Great Pyrenees that weighs 75 or 100 pounds, gosh, I don't even know how much those guys weigh. They might need 2 capsules. Okay, so but just know that you don't have to worry about overdosing it. So if you've got a dog that's say 60 pounds. It's completely fine to go ahead and give him the 2 capsules. And then same with the pony. So a 400-pound pony, you might be able to get away with doing a half dose on the pellet if you just really wanted to. But gosh, if it was my pony, I would go ahead and do the full dose because we know that's going to be effective. And we know that going over that is only going to provide additional benefit. So I probably wouldn't get too critical about trying to titrate down the dose for a pony. Now, maybe if you had a miniature and it was, 150 or 250 pounds, maybe you might want to half dose it, but it's certainly not going to do any damage to do both or to go full dose. All right, I'm going to take one more question here, and then I'll actually have a printout of all of the questions that came in, and I'll run through those after the webinar. If there's anybody that I didn't get to, we'll make sure to send an email to you guys and address your question specifically. So this last question is, would Rewind replace injectables like Adequan? Okay, so I do not recommend, I'm not positioning, or we're not trying to position Rewind as a replacement for those injectables, okay? So if you're actually trying to put, say, steroids into the joint, or if you're trying to put hyaluronic acid into the joint, okay, obviously those are going to be doing two different things and two different reasons for doing both of those. But this is simply, so the Rewind is not providing building blocks. Okay, so let's say you were going to inject hyaluronic acid into the joint. You're actually putting a quote building block back into the joint. Okay, the lubricating effect of that joint is being administered back into there to help ease the comfort. Now, Rewind will be an excellent companion for that, because, as I said earlier, it's the inflammation within the joint that breaks that hyaluronic or that synovial fluid down and breaks down the cartilage and causes all of the deterioration within the joint. So again, if you can prevent that inflammation in the first place and help keep it cleared out, you're going to have less breakdown of the joint. So I would certainly recommend Rewind as a companion to any kind of injectable therapy that you might be doing, not a replacement. So, okay, with that, I want to thank you guys all for attending. I do want to remind you, we have a new podcast out. It's called The Feed Room Chemist. We're trying to, certainly during this COVID situation, we're trying to get at least 2 or 3 episodes up a week where we just kind of hit on general nutrition topics. They generally last between 20 to 30 minutes, maybe 15 to 40. It kind of varies depending on the topic. Also, stay tuned to your email. So anybody who watched the live version of this will receive an email. It'll have a link to the replay. It'll also have a discount code so that you can actually purchase a 1-month supply of Rewind pellets at a discounted price. Okay. And then certainly don't forget about next week's webinars. So on Thursday, we've got Dr. Vandergrift discussing bleeding and airway conditions in horses. And then on Friday, I will be going over the use of equine diet balancers. All right. I hope you all have a wonderful weekend, and thank you for attending.